Once again by Dr. Todd Ellerin, Director of Infectious Diseases at South Shore Health, to talk about COVID-19. And Doctor, we always appreciate seeing you. Thank you for being here. The U.S., we just hit another milestone, 14 million COVID-19 cases. And right now it looks like that it took us 6 days to log each of the last 3 million, 3,000 deaths related to the virus in just 24 hours. So for you, an infectious disease expert, do you believe that that suggests there should be a nationwide shutdown? And what can be done at this point? We did expect this. What can be done to slow down the spread?
Maria, this is a sobering moment. The COVID risk to all Americans right now is at an all-time high. When you have over 3,000 deaths like we had in one day, it's clear that COVID-19 is the leading cause of death right now per day in the United States. It has surpassed heart disease. It has surpassed cancer. And we know that these deaths haven't even incorporated anything about Thanksgiving travel. We won't feel those effects till right before Christmas. So right now, I do believe that in many places around the country, we are going to need targeted lockdowns to really get this under control. This is at an unacceptably high level.
Including here in Massachusetts? Or does it depend on the data?
You know, obviously the governor just said that he's not looking to shut things down, but he's very concerned about the escalating cases. If things continue in this direction, remember right now, at hospital capacity is at 75% with non-ICU beds around Massachusetts. So in the spring, when the COVID influx came, we weren't seeing as many non-COVID patients. Right now, we're seeing an increase in both. If we reach hospital capacity, then we'll have to shut things down. There's no choice.
All right, Doctor.
Hopefully that won't happen.
Oh, I apologize. And Dr. Ellerin, Massachusetts is expecting to have a vaccine in the state and ready to go on December 15th. We know medical personnel are first to be vaccinated. How long before the general public can expect a vaccination?
Shana, this is so exciting to think that we have such effective vaccines that ultimately can end this pandemic, but it won't be in 2020. Most Americans are unlikely to receive this vaccine until the middle of 2021, because remember, there's probably about 100 to 200 million high-risk people that need to get this vaccine before it's going to be opened up to the general public.
Which is so interesting because we keep talking about how the numbers keep rising, but then we have hope that there's a vaccine. But the reality is we do have to be patient and know that it's not around the corner for most people. So here's a question for you, Doctor. Can someone who's infected, or if you recently had COVID, can you get a vaccine? Should you get a vaccine? What are the health requirements for getting one?
It's an important question. Remember, in the clinical trials, they did not enroll patients who had known COVID-19 infection, but they were seroblinded into this study. What that meant was the investigators and the patients didn't know those that were actually infected but didn't know it. We think that probably roughly about 10% of patients in the vaccine group and in the placebo group probably had COVID-19 just unknown. So we'll learn from that. It is important to remember survivors of COVID-19 absolutely need to get this vaccine as well, but we don't know the timing of that. So I think with time, we're going to know the benefits versus risks there.
All right, Dr. Todd Ellerin from South Shore Health. Thank you once again, and be well, Doctor. We appreciate it.